Imagine this. A healthy man in his 50s wakes up, goes to work, exercises, and feels completely normal. No pain, no warning signs, no illness. But during a routine blood test, his doctor suddenly says, "You may have cancer." The diagnosis? Prostate cancer. And here's the shocking truth. Millions of men worldwide live with prostate cancer without even knowing it. In fact, doctors say many men have no symptoms in the early stages, which makes it extremely dangerous. By the time symptoms appear, the cancer may already be advanced. But here's the good news. When prostate cancer is detected early, survival rates can approach nearly 100%. So, in this video, we will uncover what prostate cancer actually is, why it is becoming more common, the early warning signs most men ignore, the truth about SAW testing, the modern treatments doctors use today, and, most importantly, how you can protect yourself. Stay until the end, because understanding this disease could literally save someone's life. What is the prostate? Before we talk about cancer, we need to understand the organ involved. The prostate is a small gland found only in men. It sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. The prostate produces fluid that mixes with sperm to form semen. In younger men, the prostate is about the size of a walnut. But as men age, it often grows larger. This enlargement is common and usually harmless. However, sometimes the cells inside the prostate start growing uncontrollably. When these abnormal cells multiply and form tumors, it is called prostate cancer. Cancer occurs when cells lose their normal growth control and continue dividing even when they shouldn't. Over time, these cancer cells can invade nearby tissues and spread to other parts of the body. Why prostate cancer is so common? Prostate cancer is one of the most common cancers affecting men globally. But why does it occur so frequently? Scientists believe several factors are responsible. 1. Age. Age is the most powerful risk factor. Prostate cancer is rare in young men but becomes increasingly common after age 50. In fact, many men over the age of 80 have microscopic prostate cancer cells even if they never develop symptoms. Because people are living longer today, the number of prostate cancer cases is increasing worldwide. 2. Genetics. Family history also plays a major role. Men with a family history of prostate cancer have a significantly higher risk. Research shows that if a close relative has prostate cancer, the risk increases dramatically. Scientists have also discovered several genetic mutations linked to prostate cancer. These include BRCA1, BRCA2, HOCO-XB13, Na repair gene mutations. These genes can increase both the risk and aggressiveness of prostate cancer. 3. Lifestyle. Lifestyle may also influence risk. Studies suggest that the following factors may increase the likelihood of developing prostate cancer: obesity, sedentary lifestyle, high-fat diets, smoking. Environmental and socio-economic factors may also affect risk and mortality rates. The silent nature of the disease. One of the most dangerous aspects of prostate cancer is that it often develops without symptoms. Many men feel perfectly healthy while the cancer slowly grows. This is why doctors call it a silent disease. In many cases, prostate cancer is discovered accidentally during routine blood tests. Because of this silent progression, early screening plays an important role in detection. Early warning signs. Although early stages may not cause symptoms, some men eventually experience warning signs. Common symptoms include difficulty starting urination, weak urine flow, frequent urination, waking up at night to urinate, blood in urine or semen, painful urination. These symptoms occur because the prostate surrounds the urethra and can block urine flow when enlarged. However, these symptoms do not always mean cancer. Many men experience similar symptoms due to benign prostate enlargement. Therefore, proper medical testing is essential. Advanced prostate cancer symptoms are: if prostate cancer spreads beyond the gland, symptoms can become more severe. Common signs of advanced disease include bone pain, back pain, fatigue, weight loss, swelling in the legs. This occurs because prostate cancer frequently spreads to bones and lymph nodes. When cancer spreads to distant organs, it becomes much harder to cure. According to cancer statistics, the 5-year survival rate for metastatic prostate cancer is about 38%. This dramatic drop highlights the importance of early detection. How do doctors diagnose prostate cancer? Doctors use several tests to detect prostate cancer. 1 SAW blood test. The SAW test measures a protein called prostate-specific antigen in the blood. SAW is produced by the prostate gland. Higher SAW levels may indicate prostate cancer. However, SAW can also increase due to infection or benign enlargement. Research shows that SAW levels after treatment can also predict survival and disease progression. Because of this, SAW testing is widely used in prostate cancer screening. 2. Digital rectal exam. In this examination, a doctor inserts a gloved finger into the rectum to feel the prostate. They check for lumps, irregular shapes, hardened areas. Although simple, this exam can detect abnormalities in the prostate. 3. MRI scans. Modern imaging techniques such as multi-parametric MRI help doctors visualize suspicious areas of the prostate. MRI can help determine whether a biopsy is necessary. 4. Prostate biopsy. A biopsy is the definitive test. Doctors remove small tissue samples from the prostate using a needle. These samples are examined under a microscope to confirm the presence of cancer cells. Understanding prostate cancer grades. Once prostate cancer is diagnosed, doctors classify its aggressiveness using the Gleason score. The Gleason score measures how abnormal the cancer cells look under the microscope. Scores range from 6 to 10. Low scores indicate slow-growing cancer. High scores indicate aggressive cancer. High-grade tumors are more likely to spread and cause complications. Stages of prostate cancer. Doctors classify prostate cancer into stages depending on how far it has spread. Stage 1. Cancer is small and confined to the prostate. Stage 2. Cancer is larger but still within the prostate. Stage 3. Cancer has spread outside the prostate. Stage 4. Cancer has spread to distant organs such as bones. The stage determines treatment options and prognosis. Modern treatment options are: treatment depends on the stage and aggressiveness of the cancer. Active surveillance. Some prostate cancers grow very slowly. Instead of immediate treatment, doctors may monitor the cancer with regular tests. This approach is called active surveillance. It helps avoid unnecessary treatment side effects. Modern prostate cancer treatment. 1. Surgery. Surgery has evolved dramatically over the last few decades. The most common operation is radical prostatectomy. During this procedure, surgeons remove the prostate gland, surrounding tissue, sometimes nearby lymph nodes. Today, many surgeries are performed using robotic technology. Robotic surgery allows smaller incisions, more precise movements, faster recovery. However, like all surgeries, risks still exist. 2. Radiation therapy. Radiation therapy uses high-energy radiation to kill cancer cells. There are 2 main types. External beam radiation. Radiation is directed at the prostate from outside the body. Brachytherapy. Small radioactive seeds are implanted directly into the prostate. These seeds release radiation over time. Radiation therapy can be highly effective for localized prostate cancer. 3. Hormone therapy. Prostate cancer cells depend on testosterone. Hormone therapy works by reducing testosterone levels. This is sometimes called androgen deprivation therapy. Methods include medications. Surgical removal of testicles rare today. By blocking testosterone, tumor growth slows dramatically. However, long-term hormone therapy can cause side effects such as fatigue, bone loss, weight gain, decreased libido. 3. Chemotherapy. Chemotherapy is usually used for advanced prostate cancer. These drugs circulate through the bloodstream and destroy rapidly dividing cells. Common chemotherapy drugs include docetaxel, cabazitaxel, Although chemotherapy can cause side effects, it may prolong survival in advanced disease. 4. Immunotherapy and targeted therapies. Modern medicine is entering a new era of cancer treatment. New therapies target specific molecules involved in cancer growth. Examples include PARP inhibitors, used for cancers with certain genetic mutations. Immunotherapy. These treatments stimulate the immune system to attack cancer cells. Although still evolving, these therapies offer hope for patients with advanced disease. 5. The role of diet. Many people ask, can diet prevent prostate cancer? Research suggests that healthy eating may reduce risk. Recommended foods include fruits, vegetables, whole grains, fish rich in omega-3 fatty acids. Foods to limit include processed meat, excessive dairy, high-fat diets. Tomatoes contain lycopene, an antioxidant studied for potential prostate benefits. However, diet alone cannot completely prevent cancer. 6. Exercise and prostate health. Regular exercise benefits nearly every system in the body. Studies show physically active men may have lower risk of aggressive prostate cancer. Exercise helps by reducing inflammation, improving hormone balance, maintaining healthy weight. Experts recommend at least 150 minutes of moderate exercise per week. Future of prostate cancer diagnosis. Technology is rapidly transforming cancer detection. Artificial intelligence is now being used to analyze medical images and genetic data. Some machine learning models can predict prostate cancer stage with over 80% accuracy. New imaging technologies such as micro-ultrasound and AI analysis may soon improve screening accuracy and reduce unnecessary biopsies. Can prostate cancer be prevented? There is no guaranteed way to prevent prostate cancer. However, certain lifestyle changes may reduce risk. These include regular exercise, healthy diet, maintaining normal weight, avoiding smoking, regular health checkups. Doctors often recommend discussing screening after age 50. Men with family history may need earlier testing. Let's start with a real-life type of story that doctors see every day. A 55-year-old man visits his doctor for a routine health check. He feels completely healthy. No pain, no symptoms, no urinary problems. His doctor recommends a saw blood test. The result comes back slightly elevated. The man almost ignores it. But after further testing and a biopsy, doctors discover something surprising: early-stage prostate cancer. At this stage, the tumor is still confined to the prostate gland. The man undergoes treatment, and today he is cancer-free. Now imagine if he had skipped that test. By the time symptoms appeared, the cancer might have already spread to bones or other organs. This story highlights the power of early detection. How prostate cancer starts in the body. Cancer begins with DNA mutations. Normally, cells grow, divide, and die in a controlled way. But when mutations occur in certain genes, cells lose this control. Instead of dying, they continue multiplying. These abnormal cells eventually form a tumor. In prostate cancer, these tumors often grow slowly, but sometimes they grow aggressively and spread quickly. When cancer cells escape the prostate gland, they can travel through blood vessels, lymphatic channels. They may then reach distant organs such as bones, lymph nodes, liver, lungs. This process is called metastasis. Why prostate cancer spreads to bones? One of the most common sites of prostate cancer spread is bone. Doctors frequently see metastases in spine, pelvis, ribs, femur. But why bones? Cancer cells interact with bone cells in a complex biological process. Prostate cancer stimulates abnormal bone growth, leading to painful and fragile bones. These lesions can cause fractures, severe pain, spinal cord compression. This is why advanced prostate cancer often presents with back pain or bone pain. The global burden of prostate cancer. Prostate cancer is not just a medical issue. It is a global health challenge. Every year, more than 1.4 million men are diagnosed worldwide. Hundreds of thousands die from the disease. but the burden varies across regions. Higher rates are seen in North America, Europe, Australia. Lower reported rates exist in some Asian countries. However, experts believe many cases go undiagnosed due to lack of screening. As populations age, prostate cancer cases are expected to rise dramatically in the coming decades. Who is most at risk? Doctors identify several high-risk groups. Age above 50. Risk increases significantly with age. Family history. Men whose father or brother had prostate cancer have higher risk. Genetic mutations. Mutations such as BRCA2 significantly increase prostate cancer risk. Ethnicity. Some populations show higher incidence and mortality. Lifestyle factors. Obesity and poor diet may increase risk. Understanding risk factors helps doctors decide when screening should begin. The SAW screening controversy. The SAW test revolutionized prostate cancer detection. But it also created controversy. Why? Because SAW testing can sometimes detect cancers that grow so slowly they may never cause harm. This leads to a problem called overdiagnosis. Some men undergo treatments that may not have been necessary. These treatments can cause side effects such as urinary incontinence, erectile dysfunction. Because of this, doctors now recommend shared decision-making. This means patients and doctors discuss the risks and benefits before screening. Understanding the Gleason score. When a biopsy confirms cancer, doctors need to know how aggressive it is. This is measured by the Gleason scoring system. Pathologists examine prostate tissue under a microscope. They identify 2 patterns of cancer cells and assign grades. These grades are added to produce a score from 6 to 10. Lower scores indicate slower growing cancer. Higher scores indicate aggressive tumors. This score helps determine treatment options. Side effects of prostate cancer treatment. Cancer treatment saves lives, but it can also cause side effects. 2 of the most common concerns are urinary incontinence, difficulty controlling urine after surgery, erectile dysfunction. Damage to nerves controlling erections can occur. Fortunately, modern surgical techniques try to preserve these nerves whenever possible. Many men recover function over time. Myths about prostate cancer. Many myths exist about prostate cancer. Let's correct some of them. Myth 1. Only old men get prostate cancer. Truth. Risk increases with age, but younger men can also develop it. Myth 2. Symptoms always appear early. Truth. Early stages often have no symptoms. Myth 3. Screening is unnecessary. Truth. Screening may detect cancer before it spreads. Myth 4. Prostate cancer is always fatal. Truth. When detected early, survival rates are extremely high. Future of prostate cancer medicine. The future of prostate cancer treatment is promising. Researchers are developing advanced imaging technologies, genetic risk prediction tools, personalized cancer therapies, artificial intelligence diagnostic systems. These innovations may allow doctors to detect cancer earlier and treat it more effectively. What every man should do. Doctors recommend several simple steps. Know your risk. Family history matters. Discuss screening. Talk with your doctor about SAW testing. Maintain healthy lifestyle. Exercise, balanced diet, and healthy weight. Seek medical advice early. Do not ignore urinary symptoms. Many men avoid medical checkups. Some ignore urinary symptoms because they feel embarrassed. But delaying medical evaluation can be dangerous. Studies show that men who avoid screening may have a significantly higher risk of dying from prostate cancer. Awareness and early detection can save lives. Prostate cancer is common, but knowledge is powerful. Early detection can mean the difference between a simple treatment and a life-threatening disease. One small test could save your life, or the life of someone you love. If you found this video helpful, share it with the men in your life, your father, your brother, your friends, because awareness saves lives. And if you want more science-based medical documentaries explained in simple language, subscribe to the channel. Because understanding your health is the most powerful medicine of all. Many people believe if I work physically all day, I don't need exercise. But modern research shows that occupational physical activity may not protect the heart the same way structured exercise does. What type of activity do you do most? 1. Physically demanding job. 2. Desk job, but exercise later. 3. Mostly sedentary. Comment below, like the video and subscribe the channel to watch more health-related videos.